Good afternoon, everyone. Thank you for joining us today. For those of you that don't know me, my name is Jessica Pigeon. I am currently the Director of Strategic Planning at OPWDD within the Office of Strategic Initiatives. This afternoon, we're going to provide an update on our strategic plan. I'll go quickly over the plan. Then I'll provide some updates and highlights related to some of the work that we've been doing and has been underway since the release of the plan in November. And we'll leave time at the end for any questions or comments. Throughout the presentation, we will also be including some links to more information related to some of the updates that we're providing in the chat. So a quick strategic plan overview. As many of you know, our plan strives to respond to the changing needs of those we serve and improve the experience that both people with developmental disabilities and their families have within our system. To be successful in doing that, we've prioritized strengthening our workforce, technology, and cross-systems collaborations as our first goal in our 5-year strategic plan, alongside evaluation and modification of our policies and services in our second goal, all of which we believe lead to our central building blocks for the most important goal, which is goal 3 of transforming our system to make sure that our supports are holistic, needs-based, equitable, person-centered, sustainable, and lead to quality outcomes of those that we're serving. Our first goal, as I noted, is focused on strengthening our workforce, technology, and collaboration, and it includes our 3 objectives related to workforce, data access and technology, and stakeholder engagement and collaboration. Our second goal is focused on transforming our system through innovation and change. We're looking at our supports and services, our regulatory and policy changes, and research and innovation. And our third goal is focused on enhancing our person-centered supports and services by working with our children, youth, and young adult programs and having a better understanding there, supporting those with complex needs better, and addressing gaps in our services for culturally and ethnically diverse communities. As a reminder, our reporting and evaluation process includes quarterly reports, a spring data release, and then activities each summer to engage our stakeholders through a survey and also through forums and hearing opportunities. We'll then be publishing an annual update each fall in November. We'll be sharing more about our upcoming summer activities in the next few months, so please stay tuned to that. We look forward to having additional conversations around our progress and hearing from you this summer again. So in the next few slides, I'll share some of the key activities that have taken place since we released our strategic plan in November. I'd like to note that these are just some highlights and examples of the work that's been done or underway. It's not a comprehensive list, so it does not include everything that we've been working on. We'll provide some additional updates on these same projects in future updates and quarters and others throughout the year and in our annual report this fall. So for goal 1, objective 1, which is focused on improving the recruitment, retention, and quality of the direct support workforce, we're continuing to build off the more than $1.3 billion in ARPA bonuses made available to our direct care, support, and clinical staff by contracting with NADSP to provide over 2,000 DSPs from voluntary providers with access to their credential program, otherwise known as the eBadge Academy, to professionalize and improve the capacity of our DSP workforce. Those participating in this program are eligible for tiered bonuses for each of the certificates that they complete. As of the end of last month, 74% of our first round of seats for this project, which is close to 1,000 seats, were already filled, and more than 100 staff have received their certificate. We also have a partnership with the New York Alliance for Inclusion and Innovation to help reverse the impact of the workforce crisis on service providers through a technical assistance project, which is in partnership with the McSilver Institute for Poverty, Policy, and Research at New York University. This work includes creation of tools and guidance for service providers to help support sustainability of our workforce. The first part of this project was implementing an organizational self-assessment where both state and volunteer providers shared information via survey with the contractor, which includes information about recruitment efforts, benefits, workplace well-being, and other topics, and how and if the supports and recruitment, or how and if that supports recruitment and retention of our workforce and providers' workforce. The survey has been shared with over 300 providers to date, and as part of the first steps, and over 100 surveys have been completed thus far. The information that we're collecting in collaboration with our contractor will help inform the efforts that we're doing to create technical assistance and training materials that will be shared with providers to, again, support recruitment and retention of our workforce. We also have entered into a $5 million agreement as part of our ARPA work with SUNY to expand a program that will enable our direct support professionals or those interested in a direct care career to secure national certification and college credit towards a certificate, associate's, or a bachelor's degree. This micro-credential program is designed to provide an in-demand and workforce-ready skills and experience to support those already working in the profession and others new to our field. This includes providing opportunities for on-the-job training for those interested in the DSP profession. We're currently in the process of finalizing individual contracts with each of the SUNY campuses that are planning to participate. We expect there'll be over 15 SUNY campuses participating in this grant, with 4 of those schools hopefully launching their micro-credentialing program in the coming months. We're also working with BOCES and high schools with career and technical education programs to incorporate a DSP curriculum there. This will expand the pipeline of individuals interested in direct care work at the high school graduate level. We're currently working with the Department of Health and State Education on the requirements of building our curriculum on top of their existing health science programs. We anticipate launching this program in the fall of 2023. We recently released a request for proposals for a statewide recruitment and marketing campaign. The campaign goals will be twofold. The first is to promote the field of direct care for people with developmental disabilities as a rewarding and vital profession, reaching new candidate pools, and to help providers to recruit quality candidates for their positions. Future updates will be provided on this project as we get further along in the process. It's currently out for applications. Most of our ARPA workforce projects are participating in a formal evaluation, which is being conducted by the University of Minnesota, which is a national leader in this type of work. This evaluation will help support the collection of data and outcomes for both our short-term and long-term efforts around workforce, which will help us to measure and share back successes and lessons learned from these different investments. So we'll share more related to those outcomes in future updates and presentations as we have them. Related to data access and technology and investing in the technology that provides more timely information and increases access to availability of data, we continue to work on our digital transformation for our agency. We just hired a new lead for all of our IT for the agency, and we've been exploring options for updating different technology and processes around the self-direction model, our service authorization, and other areas of our work. We'll be releasing updated Medicaid data in the coming months, and we'll also start rolling out updated data tools, which will help with visualization and navigation of the data that we're sharing. We'll be doing that in the coming months as well. You'll see different updates throughout the remainder of the year. All of the information related to our Medicaid data and the timeline is in our current 507, our strategic plan. And actually we had it mapped out to take place next year, so we're excited to report that we're ahead of schedule when it comes to that. Lastly, for data, we have a lot of interest in our data community of practice. So we're currently determining the best ways to move forward to balance that level of interest with the management of a group like this. We're looking forward to implementing it in a way that's most effective. So we're discussing options to embed more conversations around data and potentially the community of practice into existing structures and long-term planning efforts. And we anticipate convening the COP in late spring. As we continue to finalize next steps, we'll keep everybody updated, as we move forward with those next steps. For promoting stakeholder engagement and collaboration, we've continued to hold our monthly and quarterly stakeholder meetings with existing groups, including with self-advocates, family members, provider organizations, FSS, and DDAC. We've been actively engaging with our partners and other DD organizations across the state and have kicked off quarterly meetings with our USED and DD Council partners. We're also continuing to participate in cross-system collaborations, including some new and reinvigorated ones, like our work with the Inter-Office Coordinating Council, which is an opportunity for us at OPWDD to work alongside OMH and OASIS and come together with representatives of the counties to discuss different challenges, needs, and promising practices. We're also in conversations with members of DDAC's Executive Committee to strengthen our relationship and collaboration with that council, including leveraging those committees to work with our Office of Strategic Initiatives, program and policy staff to make sure that we're able to support bidirectional information sharing and more transparency. Additionally, our DE&I office is participating in the Governor's Chief Diversity Officers training on how to make boards, commissions, and councils like DDAC more diverse. We're hoping to work collaboratively, with the leadership of DDAC to implement promising practices learned through this training. Our DE&I office is also evaluating representation on our different stakeholder groups, many of which I just mentioned, and outlining opportunities for us to leverage our existing groups and meetings to diversify the voices that we're hearing from. They're examining our communication approaches and tools, including both spoken and non-spoken language access services, and identifying additional groups, organizations, and mechanisms to communicate with and actively engage more demographically representative stakeholders in our conversations and in our long-term planning. The work of our DE&I office aligns with efforts of our partnership with Georgetown University to look at our entire stakeholder engagement process to ensure that our engagement is more effective, is more inclusive, and more demographically representative of the diversity of New York State. For our second goal on supports and services is strengthening the quality, effectiveness, and sustainability of those supports and services. We have a lot of different activities underway related to employment. We are participating in the U.S. Department of Labor's Office of Disability Employment Policies National Expansion of Employment Opportunities Network, otherwise known as NEON. This initiative, which seeks to support our state's network of agencies devoted to improving employment for people with disabilities, and looks to increase competitive integrated employment rates and opportunities in the state. The initiative includes federal experts providing intensive policy consultation, capacity building support, and ongoing mentoring through on-site and virtual meetings. We plan to develop a statewide cross-agency employment first division through this work. We're going to create a matrix of different agency responsibilities in the efforts and develop operating agreements between our agencies to better serve people that are interested in employment. Some of the agencies that are participating include OMH, Department of Labor, State Ed, Access VR, the Office of Chief Disability Officer, and OPWDD. Later steps of the process will include engagement with providers and technical assistance for providers, in addition to for our agencies. In November, we released a request for application to provide career-specific vocational training to people with developmental disabilities. The purpose of this grant is for voluntary providers in partnership with corporations, business associations, and colleges to develop or adapt existing career-specific vocational training that prepare people with developmental disabilities for employment by building job readiness and marketable skills needed to meet the demands of today's employers. The career-specific vocational training classes will be combined with HCBS waiver-funded community vocational experiences and job readiness skill training to increase the marketable skills needed to meet the demands of today's employers. In collaboration with Access VR and NYSID, we're also developing a training for businesses that build on the employability marketing campaign that promotes the benefits of hiring people with disabilities. The trainings will be initially offered to businesses that signed OPWDD's employability pledge and will then be expanded to the general business community. Related to housing, OPWDD continues to support the development of affordable apartments under the Integrated Supportive Housing Program and the Empire State Supportive Housing Initiative. OPWDD is also developing a process for providers to seek housing subsidy support for other projects that do not have state and federal capital funding sources. This includes our release and extension of the public comment period to the end of March for our draft request for applications for fulfills, which is the funding opportunity for independent living letters of support. The intent of that program is to provide an opportunity for providers and families to be innovative in their approaches to integrated and community-based housing. This is a new opportunity and process for our community, so we wanted to make sure we were giving everyone a chance to review and provide input on the draft request prior to publishing the actual opportunity. To date, we have received a lot of very helpful feedback, which we continue to review. So I just wanted to, pause and thank everybody who took the time to share your comments and thoughts with us on the draft document. We do truly believe that the contributions that you've made by sharing your thoughts will help lead to a better final document, which ultimately will help us to move forward together as a system in developing creative housing opportunities for all of the people that we are supporting. If you want to find more information on fulfills in that RSA draft, there was a webinar. There's also a webinar on the housing subsidy program on our website, and I believe it's being put in the chat, so you can look at both or either of those for more information. We recently sent out award notices to providers who applied for our ARPA supportive ResHab project. This project seeks to enhance person-centered service delivery and further incentivize the provision of supports and services for people with developmental disabilities to live in the most integrated settings appropriate to their needs. We're very excited to get these grants underway this summer, and we'll be sharing more information on awards and the grantees who have been selected and future updates once the contracts are formally in place. Since November, we've been participating in various conversations around health equity, especially with the New York State Department of Health. We're partnering in these conversations to address stigma and discrimination in order to improve and enhance healthcare access and outcomes for people with developmental disabilities. Through this work, we're hoping to increase healthcare provider awareness of the issues that people with developmental disabilities face when trying to access healthcare services. The proposed state budget also includes a proposal by DOH to establish a distinct Medicaid reimbursement for oral sedation and nitrous oxide, which is separate from an office visit for children and adults with developmental disabilities. They're also proposing to establish a 20% rate enhancement for privately practicing dentists who serve people with DD across the lifespan, and increase billable limits for ambulatory surgery centers for oral surgery for individuals with DD. So these are all proposed in the current budget, which at this point has not yet been approved. We also released a request for information for vendors who are qualified to provide health assessment and coordinated services for people with developmental disabilities who live in non-certified and certified residential settings and are OPWDD HCBS waiver participants. Health assessment and coordination services are telemedicine services that provide advice on when best to seek additional or in-person treatment, to coordinate care with local emergency departments, urgent care centers, and primary care physicians, to enable real-time support, consultation, and coordination of health issues, and to assist individuals, families, and support providers to understand presenting health symptoms and to identify the most appropriate next steps 24 hours a day and 7 days a week. We're currently evaluating the information that we've received related to that project. For our assistive technology efforts, we have been implementing an ARPA grant, which has been underway since May of 2020. We already have a lot of very helpful suggestions and information coming in from that evaluation, which we're using to draft some new workflow improvements for the application and approval process of our assistive technology and environmental vehicle modifications. We're also developing language that's being included in our upcoming waiver amendment to enhance program design and inform some other long-term program modifications and considerations. So you can read more about that in our waiver amendment, which I will touch on momentarily. We're also in the process of updating our communications and materials related to our coordinated assessment system, otherwise known as CAST. We'll be sharing more information and providing updates in the coming months related to that. Since we began implementation of CAST in 2016, over 100,000 people have participated in completing their assessments. Related to self-direction, we're planning to release an ARPA call for proposals for the evaluation of our self-direction model very soon. We have also been hiring staff and changing internal review processes and have made great progress on reducing the backlog of our self-direction budget approvals. We've been implementing more streamlined review processes and outlining opportunities to invest in IT to move from a manual to a more automated review system. Additionally, we've continued to provide training and education to our FIs, brokers, and care managers related to self-direction. For regulatory and policy changes and trying to create greater flexibility and increase opportunity for community integration and incentivize improved personal outcomes, we've been working to streamline the process that we use for our higher needs funding for both residential services and day programs. We started by streamlining the process for Tier 3 and have since expanded to people who are already receiving services. These updates to the process will allow providers to access higher needs funding more quickly and provide additional funding for DSP and clinical hours when appropriate. Many of you are likely aware that the public health emergency will be coming to an end. With the end of the public health emergency, we have been hard at work drafting and updating different guidance, creating trainings and policies as we prepare to transition back to our new normal. We'll be sharing more information in the coming months related to some of those efforts. We're also working to create a clear timeline and understanding of our eligibility and service authorization processes, including identifying opportunities to streamline that process, improve information exchange, and provide training to providers, CCOs, and OPWDD regional staff. We'll continue to share information on these efforts as progress is made in future updates as well. Based on the recommendations and information shared during a provider work group that concluded at the end of 2022, we've made edits to the draft CRO ADM. Next steps include the draft CRO ADM being shared for public comment pursuant to our new ADM policy, and then finalizing updates to the forms based on suggestions shared by providers. We've been creating and providing training for the CCOs and care managers, providers. Our OPWDD certified housing teams have also been starting to have trainings, and we'll continue to hold those trainings to ensure that global understanding of our certified residential opportunity, otherwise known as CRO, processes. We continue to work alongside our partners at the Department of Health, CMS, CCOs, and with providers to prioritize the implementation of our HCBS settings rule. This is work that's been in process for numerous years, but we'll continue to refine and develop new information and policies in alignment with the additional guidance that we've been receiving and has been shared more recently. As I alluded to previously, we're submitting a waiver to CMS in June with anticipation of its approval by October. The amendment aligns with the end of the public health emergency, which will be on May 11th, and the expiration of our Appendix K authority on November 11th of 2023. The submission will include a series of waiver amendment actions to address programmatic, rate setting, administrative needs, and routine cleanup of waiver language. The draft is available on our website currently, and our public comment begins tomorrow. We're hosting WebEx sessions to provide more information and an overview of the proposed changes tomorrow as well. Our Division of Quality Improvement has continued their monitoring role and is actively engaged in drafting a process to move the agency forward toward creating an agency-wide quality improvement strategy. Additionally, they've been working to provide additional and new opportunities to engage with providers on training, systems enhancements, lessons learned, and hearing more about promising practices in the field. They've held several discussions in the last few weeks with providers and kicked off a new bi-monthly webinar series on key topics of interest and importance to providers going forward. For example, they've recently held one on HCBS settings and best practices related to those, and that had over 1,800 people who participated. In addition to the previously noted modifications to different policies and regulations, we're also reviewing our policies for cultural and linguistic competency and ensuring that we are advancing our goals of diversity, equity, and inclusion as part of our Georgetown University Systems Change project. For our third objective under Goal 2, Research and Innovation, we'll be implementing a CCO program evaluation using our American Rescue Plan ARPA funding, which will engage an external consultant to evaluate our CCO model, including identifying promising practices and areas and policies that can be changed to improve the quality of care managers and the model. The evaluation will include opportunities for people to share their experiences and stories engaging with CCOs and care managers. It will include reviewing our current procedures and identifying opportunities to streamline our processes. We're currently in the process of reviewing and scoring those applications and should have a selected contractor in the next few weeks. In January, we also began a quality case review project, which focuses on the effectiveness of care management from both the personnel and family and CCO perspective. This includes the person and family satisfaction levels and an assessment of care managers' abilities to resolve challenges and improve access to services. The information collected through this project will be shared with the CCO program evaluation consultant and will further inform future modifications to the CCO model as needed. As part of our ARPA efforts, we are also currently in contract with Guidehouse to research and evaluate whether managed care or a different method of service delivery would best align with OPWDD's strategic goals and objectives. As part of the contract, Guidehouse submitted an initial report to OPWDD, which provides a broad landscape on managed care in New York State and outlines the evaluation effort going forward. The initial report, which OPWDD submitted to the legislature in early January, can be found on our website. As part of next steps for this evaluation, Guidehouse is conducting national research and a peer state review to assess the successes and challenges of managed care and long-term services and supports for people with developmental disabilities, and also developing informational resources on managed care more generally, which can be used as they begin their stakeholder engagement activities in the coming months. Related to those who are aging, we're participating in the state's Master Plan for Aging initiative. This project is designed to ensure that older adults and people of all ages can live healthy, fulfilling lives while aging with dignity and independence. The Department of Health and the New York State Office for the Aging are coordinating the work alongside partners from many other agencies, including OPWDD. We have leadership represented on the Health and Wellness Subcommittee. One of the focuses of that subcommittee includes recognition and discussions on the role of aging caregivers and what in that role and how the role they play in our long-term care systems in New York State. For our third goal, to enhance our person-centered supports and services, when it comes to children, youth, and young adults, we're working with the Conference for Local Mental Hygiene Directors, otherwise known as CLMHD, to identify gaps in current systems and propose solutions, especially in relation to services for children. We're also partnering with OMH and DDPC to create 2 home-based crisis intervention teams to specifically respond to youth with developmental disabilities who are living at home and experiencing a mental health crisis. OMH is providing $6.8 million over 5 years to fund those teams. DDPC is investing $1.5 million to support the specialized staffing in the pilot period, and OPWDD is providing training and technical assistance. The teams will deliver specialized support to young people with developmental disabilities at risk of being placed in a more restrictive setting because of their mental health challenges. The RFP for this opportunity was actually released last week. For those interested in learning more about it or for applying, we are putting the link in the chat for that as well, and there has been some releases in media related to that this week. Related to CANS, which is OPWDD's Person-Centered Needs Assessment for people who are age 17 and younger and their families. The CANS assessment tool is designed to give a profile of the specific current needs and strengths of a child or adolescent and caregivers. We're using a portion of our ARPA funds to accelerate the completion of those assessments and to train staff and assessors. Since 2021, we have approximately 9,700 assessments completed. Lastly, we continue to pull together data that we have related to children and youth in our system to have a better understanding of needs as we plan for the future of our service delivery system. We have a lot of promising projects already underway and beginning to help support people who may be in crisis and people who have complex medical and behavioral needs, as well as those that interact with multiple service delivery systems like mental health and OPWDD. These include the continued implementation of our CSIDD and expansion of that work across the state, piloting mobile crisis supports that have been promising in the mental health sector as part of our ARPA project with CLMHD, and providing technical assistance to providers to support them to better serve people with complex needs through our recently established technical support teams. We also have a new initiative with OMH as part of a national grant that they were recently awarded. New York State was awarded Transfer Initiative Grant. The focus of this grant is to implement a Project ECHO program for New York State crisis providers that focuses on serving individuals who are duly diagnosed with mental health symptoms and developmental disabilities. The Project ECHO proposal will build upon New York State's ongoing process to create a robust learning environment for the crisis workforce. We also continue to invest in and develop programs that provide transitional placement opportunities and step-down models across the state, and we'll provide more updates on this work in future presentations as well. To address gaps in services for underserved culturally and ethnically diverse communities, we're very focused on increasing the equity of our system, including making sure that we understand the diverse needs of people we serve and support, and recognize the various cultural and linguistic components of our work. We have a contract underway with Georgetown University's National Center for Cultural Competence to help support OPWDD and the DD system across New York in this regard. We meet with them regularly and have already participated in some training and important level-setting conversations as a leadership team, and they will continue to support our agency's larger efforts by providing trainings for the next 4 to 5 months to our leadership team as a first step. We're also planning to introduce the Georgetown team in more specifics of their work in the coming months as part of our future strategic plan updates and other presentations and conversations. Our partnership with Georgetown University is just one of the many approaches we're implementing to support our system's capacity to better serve ethnic and other minority communities. Other work that is underway and continues includes our second year of our Ensuring Access project, which focuses on increasing access to our front door by improving cultural and linguistic competency of our materials and our trainings, and also reducing barriers to accessing the front door. Front door information sessions will be shorter and easier to understand overall as part of this work. They'll feature universal symbols, closed captioning, and voiceovers in Spanish and Mandarin, which are the top 2 spoken languages in New York State after English. OPWDD is also prioritizing efforts around language access in other ways, which is really crucial to accessing information and services. Our D&E&I office recently hired a new full-time language access coordinator. We'll be collaborating with our staff, providers, and CCOs, and those who interact with our services to update and improve our language access policies and procedures. Part of this work includes implementing best practices for cultural and linguistic competence, providing better quality and quicker translations, and meeting the needs of people who use languages other than English, including sign language. It's worth noting that we're one of the only state agencies that has a dedicated full-time person for language access work at this point. All of our language access work also includes expanding our use of plain language and creating more understandable materials across all agency communications. I also want to take a moment to let everyone know that a plain language version of the strategic plan is available and on our website in the top 12 spoken languages of the state. If you haven't had a chance to check it out yet, I encourage you to do so. Please also feel free to share it with your networks. This concludes the formal presentation part of today's meeting. At this time, we'll open it up for questions and comments specific to the content that's been shared in today's presentation. I'll ask if you're interested in asking a question or making a comment that you raise your hand, your virtual hand, and we can call on you. You are able to unmute yourself once we call on you. And I'll just give it a moment so you can raise your hand if you'd like to. Okay, so the first person I see is Ralph Warren.
Okay, so I unmuted. All right, well, thank you. It was, very comprehensive, but honestly, I feel like we could have gotten this a couple days ago in terms of either print or even recorded, audio recorded. It's a great summary of what's going on, but we need more time to have a discussion. So I just want to say real quick, my perspective on this, over the past year, I've had a chance to get back involved with national projects as well as some other state Medicaid long-term care projects, including ongoing involvement with the public participant with Managed Care Review Panel for the Department of Health for their mainstream managed care programs. We're not getting the full information that we need to. More important, out of OPWD, for example, with that last MCARP panel, there's a report, one-time report I was helpful to get facilitated out of that committee. 40,000 people are in mainstream programs for managed care. But that's just one kind of piece of data. My concern to be focusing on a single question that could be answered by one or more staff today is please give us more detail on the Medicaid claims data that is available now that you're working with. I know from one of the regional things I'm involved with, I won't say which one specifically, that regional office staff have informed us that a great deal of work is being done that we knew could be done to make data available, at least internally, to OPWD based on Senator Mannion's legislation last year to get better outcome, better data reporting. So how are you going to involve us with two things in the next 2 months? The data community of practice and also the managed care work done by Guidehouse, because Guidehouse has released really great work they've done in other states that show that they've involved stakeholders up front in a much more clear way than has happened for us so far. So those are my two questions.
Thanks, Ralph. So related to the data COP, we will have more information coming out in the next few weeks to months related to that process. We're pulling together, we had a lot of interest, so we're trying to figure out how we can pull together the COP, but also consider different ways that we can be talking about and sharing data beyond just the COP, because we know there's a lot of interest there. And then related to the managed care guidehouse, a big part of that work in the coming months will be engaging with stakeholders, to get the different perspectives and views on the project. So there will be opportunities for people like you and others to participate in that evaluation and those conversations.
Yeah, but one
and related
clarification. The point is that if you read the Guidehouse report I've sent around to folks here, that probably most people on the advocates anyway have gotten it, there was more effort and opportunity upfront, even in this RFP, and has been done by Guidehouse in other states, to involve stakeholders not just as passive recipients of information, but as forming the way the evaluation would go forward, and we have not had that opportunity.
Yeah, I think that, as part of what we'll be doing as the next steps for that project are actively engaging with stakeholders. So we've submitted, we shared that initial information that we pulled together, but that was just a very small part of the overarching project. So we will be engaging with, you and other people as part of the evaluation next steps. And we also released in the spring, and we'll be having that again in the next month, should be released, Medicaid data on our website. So that will be available, and we're currently working with new platforms to be able to help support stakeholders who are accessing and interested in the data to access it in a more visually appealing and understandable way. So you'll see the update this spring, and then you'll see some additional updates and new data that will be released throughout the next few years, utilizing that new platform, which will be easier to navigate.
Thank you.
Yep. So next I see Leslie Feinberg.
Hi, Jessica. Thank you for that very intense and thoughtful presentation. There's a lot there, as Ralph said, there's a lot there to think about. I was just wondering if there'll be a response to public comment on the FOFIL?
Yes, there will be a response to public comment.
Do you have any idea when that's due out?
We're still going through the information that we received, so you should see it in the coming months, but we want to make sure that we have the opportunity to really review what's been coming in.
Okay, thank you.
You're welcome. Roy? Roy, you should be able to unmute yourself, but let us know. Well, you can't let us know. We're trying to help unmute you, but you should be able to unmute yourself.
I can do it. Sorry, I was cleaning my glasses and I wasn't looking up, so I could see.
No worries.
Anyway, thank you for the presentation. It was very fulsome. A couple of questions on accessibility and fillability. Well, plain language is wonderful. I worked in the insurance industry, and we went out of our way to be as obtuse as we could be. So I'm glad you are embarking on but what about making forms fillable and also accessible to people who are visually impaired or and so forth, so that these will be accessible to a wide number of people, and understanding that the PDF is not satisfactory and forms not fillable again in PDF are not satisfactory.
Yeah, thank you for the comment. All of those are additional areas that we're looking at. So we want to make sure that as we're improving our different documents to make them not only plain language but more accessible, we're looking at those type of elements as well. So we're looking at it from a more holistic approach. And if you or anybody else has specific suggestions on ways that we can do that, please feel free to share that forward with us.
Thank you.
Next is Arnold Eckerly.
Yeah. Hey, Jessica. So,
Arnold.
sorry, I think I missed a little bit of the CAS section, but I just want to understand what you were doing as far as stakeholder feedback and experience with CAS, because I know, it's been an ongoing issue, that we've heard mostly negative things, to be frank, for a long time about CAS, the process for people. A lot of times, a lot of times people just don't really understand what the process is about for them. The process is often very confusing. It doesn't seem to be transparent in many ways. I know there's still a lot of issues where people feel that it's not necessarily clearly reflective of their needs. So anyway, I'm sure you guys have heard a lot of this already, and not just from us. But as far as CAS goes, what is going on there in terms of ongoing evaluation and improvements?
Yeah, so we have, ongoing evaluation that we build into that process. Some of what we're doing, more specifically in the coming months is really looking at how we're communicating about CAS and making sure that it's a bit more understandable. There's simplification in the materials, sharing some of the results that we've had related to that process since we've been implementing it, and looking at some of the next steps, for CAS and where we see that fitting in the system moving forward. So we have a lot of different stuff underway, all of which, we're keeping in mind some of what you've shared as well, Arnold, as we're looking at how to, better communicate related to that work.
Thank you.
Mm-hmm. Next is Jim Karp.
Yeah, thank you. So I'll just quickly echo, thank you for the thorough presentation. You made mention of Guidehouse, that some of the activities they're doing to look at managed care, to evaluate what's going on in other states. My question is, if we're trying to evaluate whether managed care or something else makes sense for our future, it would make sense to me for us to be looking at things other than managed care as well. So is that part of the portfolio that's been given to Guidehouse, to look at things other than managed care that can be done in our system? Or is there some other group that's engaged in that process?
Yes, that is part of what we're asking for the evaluator to be doing.
Okay, so they're not limiting themselves solely to looking at managed care. They're looking at all sorts of other things across the spectrum of services.
Correct.
That's great to hear, and look forward to the opportunity to engage with them.
Great, thanks, Jim. Next is Karen Nagy.
Hi, thank you. I just have two quick questions on the CO evaluations. My first question, you mentioned that you should have a proposal out within a couple weeks, and wondering if you can give us a time frame for the responses to that RFP. And then secondly, what will the length of that evaluation be, and what will the scope of that evaluation cover?
So the proposal was actually already released. So right now we are in the process of reviewing and finalizing a selected contractor for that evaluation. And the expectation is that project will get underway in the coming months as we finalize the contract with whoever the selected contractor will be, and will likely go until June of 2024. The contract.
Okay, thank you.
You're welcome. So we do have a few minutes left. I know some people have put some questions in the chat, so I'll try to get through as many as possible.
We will be posting the recording for those who were unable to attend to listen from the website link.
Yeah, it looks like we have a question from, I think it was Beth, related to the 5-year Medicaid evaluation extender to be approved. You know, we can't speak to anything currently in the budget, proposed budget. So I don't have a specific answer for you there. And I believe that's all of the questions that we have. We do have time for one more if there's anyone else that has anything they'd like to ask.
Well, let's ask one more thing. I'd just like to, if I get a minute, just to clarify one thing about the data that's so important. The health claims data. In other words, what people have claimed in terms of services for any medical condition is so important to many of the things that you mentioned, Jessica. I probably at least 4 of the top level subtopics under the goals and the subtopics under the goals of those. For example, the crisis service, the changes in crisis service, how medical things impact complex needs in behavioral care. All this is, that's why it's so important, and why I would hope that in these forums that you would give more opportunity for in-depth discussion. That's all.
Thank you, Ralph. Lisa Fleischer, looks like you have another question.
Yes.
Potentially.
Yeah, I'd like to go back to the CAS for a second. I hear that you're working on getting better communication with people about what to expect in the CAS and how to better understand the summaries of the CAS. What about efforts in regard to vetting what the assessor interpreted from the interviews and being able to appeal the results or the summaries? Because I understand that the first that anybody gets to hear, including the care manager, gets to even see the results is after it's been published. And it's very difficult to change anything within that, particularly when there's misinterpretations. So are you doing any work on that aspect of the CAS?
Yeah, so we continue to look at, you know, similar to all other, you know, different parts of our system, and evaluate on an ongoing basis what we're doing. Part of what we'll be sharing in the updated information materials is more clear information around the process if you have questions or concerns related to CAS. So you will see some of that reflected in that information that we'll be updating.
Forward to seeing that.
Okay, so if there's no further questions, we are just about at time. So we appreciate everybody's participation this afternoon. We look forward to providing another update in the next few months, and hopefully seeing some of you over the summer as we provide updates and engage and provide opportunities for more discussion and sharing at those events as well. So thank you again, and have a great evening.